The coronavirus outbreak continues to advance around the world. The number of cases in China and South Korea keeps rising, but at a slowing rate. However, the outbreak in Iran, Italy, Switzerland, and now France and Germany is growing. In Italy alone, we've seen 1,492 more cases overnight and 102 more deaths. Here in the UK, as of this morning, there were 319 confirmed cases. Very sadly, this now includes 4 confirmed deaths. I entirely understand why people are worried and concerned, and we send our condolences to the families. The UK response is guided by our 4-point action plan. We continue to work to contain the virus, but we're also taking action to delay its impact, to fund research, and to mitigate its consequences. Throughout, our approach is guided by the science. That is the bedrock on which we base all our decisions. Our plan sets out what we're prepared to do, and we'll make the right choices of which action to pursue at the right moment. The scientific advice is clear. Acting too early creates its own risks, so we will do what is right to keep people safe. Guided by the science, we'll act at the right time, and we'll be clear and open about our actions and the reasons for them. Madam Deputy Speaker, these are the principles that underpin the very best response to an epidemic like this. Turning to research, I can report to the House that we've made available a further £46 million to find a vaccine and develop more rapid diagnostic tests. We'll continue to support the international effort. Here at home, the NHS is well prepared with record numbers of staff, record nurses and record doctors. I want to thank all those involved for their work so far. The number of calls to NHS 111 has increased, and we've now added an extra 700 people to support that effort. 111 online is now dealing with more inquiries than the voice calls. To date, Public Health England has tested nearly 25,000 people, and the time taken to test is being reduced as we're bringing in a new system for faster results. But of course, responding to coronavirus will take a national effort, and everyone must play their part. Of course, that means government. It also means everyone washing their hands more often and following public health advice. But there is much more that we can all do, both through volunteering and through support for those who are the most vulnerable. We'll shortly bring forward legislative options to help people and services to tackle this outbreak. The bill will be temporary and proportionate, with measures that last only as long as necessary, in line with clinical advice. And I can also report that over the weekend, we initiated action to help 120 passengers on the Grand Princess cruise ship off the coast of California to assist them in coming home. Madam Deputy Speaker, we will stop at nothing to get this response right, and I commend this statement to the House.